Welcome to the We Level Up Treatment Center video series. In today's video we will discuss how to overcome depression. Medication and therapy are often efficient in depression treatment. A psychiatrist might write prescription drugs for depression symptoms. It might also be beneficial to see a psychologist or other mental health expert. An inpatient stay with counseling programs might be necessary in severe cases until symptoms improve. To determine if you are depressed, your doctor may do specific blood tests, evaluate your physical condition, converse with you about your thoughts and feelings, and look up the clinical criteria for depression. A persistent loss of interest in activities, profound grief, and hopelessness are characteristics of depression. Melancholy, or sadness, is a common emotion that passes rapidly. Your everyday functioning, sleep quality, and eating habits may also be impacted. The connection between depression and addiction. According to the Substance Abuse and Mental Health Services Administration, SAMHSA, certain drugs might cause depression in those who are addicted. Also, people who struggle with depressive disorders may turn to drugs or alcohol as a coping mechanism. Genetics, early stress or trauma exposure, and brain chemical imbalances are frequent causes of both drug abuse and depression problems. It shows how closely related substance abuse and mental health may be. Depression is also associated with high rates of suicidal behavior and mortality. According to the CDC reports, suicide was responsible for 48,183 deaths in 2021, which is about one death every 11 minutes. An estimate is that up to 60% of people who die by suicide have major depression. What is depression? Depression is a common psychiatric condition. In the initial stage of a major depressive episode, the goal of treatment is to bring the patient to a state of normalcy and help them return to their usual level of functioning. Antidepressant prescriptions, particularly SSRIs, selective serotonin reuptake inhibitors, are often the primary choice during this phase. Psychotherapy focused on depression comes next in line, aiding patients in overcoming the acute phase and preventing relapses. A combination of medications, psychotherapy, and somatic therapies is the most effective for cases immune to initial treatments. What are the types of depression? Major depressive symptoms can differ from person to person. To pinpoint the type of depression you have, your doctor might use clinical criteria. Different types of depressive disorders include major depressive disorder, MDD, characterized by persistent feelings of sadness or a lack of interest in activities. Persistent depressive disorder, dysthymia, a milder but chronic form of depression lasting for at least 2 years. Bipolar disorder, manic depressive illness, involves periods of depression and episodes of mania or hypomania. Seasonal affective disorder, SAD, depression that occurs at a specific time of the year, often in the winter months. Postpartum depression, occurs in new mothers after childbirth and involves feelings of extreme sadness, anxiety, and exhaustion. Psychotic depression, combines severe depression with psychosis, involving delusions or hallucinations. Premenstrual dysphoric disorder, PMDD, severe mood swings occurring in the luteal phase of the menstrual cycle. Atypical depression, a subtype with symptoms like weight gain, increased sleep, and mood reactivity. Situational depression, caused by specific stressful events or life changes. Cyclothymic disorder, a chronic mood disorder with alternating periods of hypomania and mild depression. These are just the most common examples of depressive disorders, and the experiences of individuals with depression can vary widely. Other conditions and risk factors that can cause depressive symptoms include hypothyroidism, chronic illness, neurological disorders, substance abuse or withdrawal, grief or loss, medication side effects, sleep disorders, chronic pain, malnutrition, hormonal changes. Depression treatments. Depression is a constant public health problem for which treatments must be personalized and simplified to enhance current practice. Several therapies have been suggested worldwide, with varying levels of validity and efficiency. Nevertheless, managing the acute phase of depression is only the first step in a long therapy process that aims to maintain remission, or the normality of an individual's mental health, and prevent relapses. Finding the suitable medication treatment plan for depression. Antidepressants may be a viable choice for you as well if a family member has used them successfully. However, finding the ideal drug might take some time. You might need to experiment with various brands or combinations before settling on one. It requires patience because some medications take weeks to show full effects and for side effects to ease as your body adjusts. Inherited traits influence your response to antidepressants. Genetic tests may offer insights into how your body might react to a specific antidepressant. Still, other factors, not just genetics, can influence how you respond to medication. Moreover, many people are now trying to use ketamine for depression treatment. Still, since ketamine is associated with a higher risk of drug abuse and addiction, it cannot be recommended in daily clinical practice. Ketamine is not a miracle drug, and many essential factors still need to be defined, such as the most effective dose and the optimal administration route. The current lack of guidelines about the therapeutic monitoring of ketamine treatment for depression further complicates the expanding use of this therapy. The dangers of abruptly stopping antidepressants. Always consult your doctor before stopping an antidepressant. While they aren't addictive, abrupt discontinuation or missing doses can lead to withdrawal-like symptoms and worsen depression suddenly. Collaborate with your doctor to gradually and safely reduce your dose and to help you adjust to non-medication therapy. Antidepressants and pregnancy. Certain antidepressants may raise the danger to the health of your unborn child or nursing kid if you are pregnant or breastfeeding. If you get pregnant or want to become pregnant, visit your physician to consult the use of depression medications and to weigh the benefits and risks. Why do antidepressants cause suicidal thoughts? Although the majority of antidepressants are typically safe, the FDA mandates the black box warning for some antidepressant prescriptions because of a possible rise in suicidal thoughts or actions in children, teens, and young people under the age of 25. Close observation is essential, particularly in the first few weeks or when there are dose adjustments. It's critical to get in touch with a doctor or seek emergency assistance if there are worries about worsening depression or strange behavior. It's crucial to remember that antidepressants have a greater tendency to lower the risks of suicide over time by elevating mood, but the initial side effects might cause them. Lifestyle changes and tips to combat depressive symptoms. Even though there are medications, there are also lifestyle changes and tips to combat depressive symptoms. Here are a few things you can do to help you elevate your mood. Regular exercise. Healthy diet. Adequate sleep. Social connections. Mindfulness and relaxation techniques. Limit alcohol and caffeine. Sunlight exposure. Establish routine. Set realistic goals. Engage in hobbies. Practice gratitude. Avoid isolation. Cognitive behavioral techniques. Express yourself creatively. Volunteer or help others. Monitor negative thoughts. Stay hydrated. Music and art therapy. Progressive muscle relaxation. The most effective and evidence-based psychotherapies that could help treatment-resistant depression include cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, psychodynamic therapy, interpersonal therapy, IPT, mindfulness-based cognitive therapy, MBCT, acceptance and commitment therapy, ACT, behavioral activation, schema therapy, eye movement desensitization and reprocessing, EMDR. The healthcare professionals at We Level Up Texas Inpatient Depression Treatment and Dual Diagnosis Rehab believe that addressing both the underlying issues and addiction together boosts the chances of successful, relapse-free recovery. Once we identify and start treating the mental health problems tied to alcohol or drug dependency, it brings individuals closer to long-term sobriety. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.